New reporting alleges the provincial government fired the board of Alberta Health Services the same day it was set to receive a report from investigators looking into its business deals. It's the latest claim in a seemingly never-ending story around the way the Smith government has handled health procurement, but one the province isn't eager to talk about. Tim Brooke explains.
The Globe and Mail says newly obtained documents show the board of Alberta Health Services was concerned about AHS business deals. So much so, in fact, that some members allegedly forwarded a letter to the Auditor General about government officials meddling in operations. And the board was supposedly set to receive a report on those deals, but instead, that same day, January 8th, the health minister fired them.
So the government statement of defense has been filed on this AHS HR issue, and right now we have no further comments to make on it.
Adriana LaGrange is still refusing to comment on the accusations, but the deals in question do seem to have some red flags. One, for children's medication, is being looked at especially closely. The Globe says the province was aware it risked significant net loss before ordering the so-called Turkish Tylenol, but it still went ahead, leaving taxpayers with a $70 million bill for meds that were pulled off shelves and are now being shopped around Ukraine.
We asked them to see if they could procure it. They found a provider and we moved forward with the decision.
The entire situation is being looked at through an Auditor General review and a third-party investigation ordered by the Premier and the RCMP.
We need to be able to get the answers, and if there's some changes, then I'll be able to make that judgment at that time.
But is there anything that could come across your desk that would make you say, now's the time for the inquiry?
Not yet.
So that public inquiry isn't coming anytime soon, despite calls from the opposition NDP leader.
This would be so easy for the Premier. If she's done nothing wrong, have them do that work and clear her. She's too scared to do it.
None of the allegations have been proven in court.
It's a very awkward situation for the government to be in. And under normal circumstances, it would elicit the resignation of the minister.
And Tim joins us live tonight with more details. Tim, the health minister is now calling this an HR issue.
Yes, Ian, she used that term a number of times today while discussing Athena Mentzelopoulos and that lawsuit filed by the former head of Alberta Health Services. Now, we should note, Mentzelopoulos responded to the province's statement of defense this week, and in that response, she really pushed back against those claims from the health minister and the premier that she was let go because of job performance. In fact, she called some of those claims, quotes, entirely fictitious and malicious. And Ian, Mentzelopoulos also reiterated once again that she is more than happy to settle this all in court under oath.
All right, Tim, thanks for the update.